Strepsils Lidocaine 24 tablets. Description: Strepsils Lidocaine lozenge. Dosage and administration. Reserved for adults and children over 6 years. Take the lozenges between meals. Adults. 1 lozenge to be melted slowly in the mouth without chewing, to be renewed if necessary after 2 hours, not exceeding 8 lozenges per day. Children from 6 to 15 years. 1 lozenge to be melted slowly in the mouth without chewing, to be renewed if necessary after 2 hours, not exceeding 4 lozenges per day. Strepsils Lidocaine lozenge, pharmacodynamic properties. Preparations for the throat. ATC code, R02AA20. Lidocaine hydrochloride, local anesthetic. Amylmetacresol and 2,4-dichlorobenzyl alcohol, local antiseptics. Strepsils Lidocaine tablet, pharmacokinetic properties. Not applicable. Precautions for use. Strepsils Lidocaine tablet, contraindications. Reserved for adults and children over 6 years of age. This drug is contraindicated in the following situations. Known hypersensitivity to local anesthetics or other components of the tablet. Due to the presence of glucose and sucrose, this drug is contraindicated in cases of fructose intolerance, glucose-galactose malabsorption syndrome or sucrose isomaltase deficiency. Strepsils Lidocaine lozenge, warnings and precautions for use. Warnings. Potential for misdirection by anesthesia of the oropharyngeal junction. Use with caution in children under 12 years of age. Do not use this drug before meals or before drinking. The indication does not justify prolonged treatment beyond 5 days, especially as it could lead to an imbalance in the normal microbial flora of the oral cavity with a risk of bacterial or fungal spread. Repeated or prolonged treatment of the mucosa may expose the patient to the risk of toxic systemic effects of contact anesthetics, damage to the central nervous system with convulsions, depression of the cardiovascular system. Precautions for use. In case of persistence of symptoms beyond 5 days and/or associated fever, the course of action should be reassessed. The attention of sportsmen and women should be drawn to the fact that this specialty contains an active ingredient which may induce a positive reaction in tests carried out during doping controls. Due to the presence of glucose and sucrose, this medicinal product is contraindicated in cases of fructose intolerance, glucose and galactose malabsorption syndrome or sucrose isomaltase deficiency. This medicinal product contains 2.5 g of sugar per lozenge. Please take this into account in your daily intake. In the absence of data on this association, as a precautionary measure, it is preferable not to use Strepsils Lidocaine during pregnancy. Strepsils Lidocaine lozenge, interactions with other medicinal products and other forms of interaction. Not applicable. Strepsils, pregnancy and lactation. Pregnancy. In the absence of data on this combination, as a precautionary measure, it is preferable not to use Strepsils Lidocaine during pregnancy. Lactation. This drug may be taken during lactation. Strepsils, effect on ability to drive and use machines. Not applicable. Strepsils Lidocaine lozenge, adverse reactions. Possibility of allergic reactions to local antiseptics or local anesthetics. Temporary numbness of the tongue and false mouths, see warnings. Strepsils Lidocaine lozenge, overdose. Not applicable. Strepsils, preclinical safety data. Not applicable. Strepsils, incompatibilities. Not applicable. Strepsils Lidocaine lozenge, conditions of use. Not subject to prescription. Strepsils Lidocaine lozenge, appearance. Round green lozenge. Strepsils Lidocaine lozenge, nature and contents of outer package.